Hi, today I have a very short share of a hypertensive patient deteriorate rapidly in the ER. We have a 69 years man present to the emergency department with sudden onset of cruising substernal chest pain. He had a history of hypertension, hyperlipidemia, and erectile dysfunction. His blood pressure is 150/85 and his heart rate is 90. His lungs are clear and there's no elevated jugular venous pulse, and there's no murmurs or gasps. His ECG valves has T depression in lead 2, 3, V5, V5, and V6. And he's confirmed coronary artery disease and received the treatment, but his blood pressure collapsed and had a drastic episode of hypertension. So, what how does it happen and what might leading to such a emergency situation? So let's look at what we can get from this case. And firstly, he received the treatment for coronary artery disease. So you may think of he's probably get aspirin, clopidogrel, and then nitroglycerin, and then in some case he might also get receive beta blocker. And he and we look at his history. He had a history of hypertension, hyperlipidemia, and erectile dysfunction. And what is the most important disease you look at? Actually, it's not hypertension. It is erectile dysfunction because in such patient they have a high chance of also taking Tadalafil, which is a phosphodiesterase type 5 inhibitor. So this patient usually had this prescription, and how it works, it releases the muscle in the blood vessels and then help them to increase and maintain the blood flow and then to get through the erectile dysfunction. But in this case, since this medication already relaxing the blood vessel, so there's gonna be a bit dropping of the blood pressure. And previously his prescription might address it well, but in this situation, if he receive a like out of the plan IV beta blocker, and this will cause a collapse of his blood pressure and leading to this situation. And so yeah, he received IV metoprolol, which is strictly contraindicated in this case. I didn't mention he's taking Tadalafil on purpose because you may not know, and this is your job to ask or try to figure it out before you make the prescription. So be very care of it. And this is the end of my sharing, and thank you so much for your listening.